Hello everyone, I am Veronica Schiariti. I am a developmental pediatrician affiliated at the Division of Medical Sciences at the University of Victoria in British Columbia, Canada. First of all, thank you for the opportunity to share my experience on ICF teaching and education, and an apology for not being there. I am actually presenting in Argentina. The title of this presentation is ICF Electronic Open Access Courses in Latin America, Lessons Learned. And briefly, I led the development of the ICF Core Sets for Cerebral Palsy for children and youth. And the paper was published in 2014, and there has been a lot of interest in learning more about the ICF and applying the ICF courses in clinical practice in different countries. So due to the interest, I developed the content of this course, and I invited a colleague in Chile to share his practical experience applying the ICF. And I want to show you the result of sharing the content and sharing the course set in different countries in Latin America. Following the format of the conference and the poster template, I think the key message from this work was that the global ICF education, including open access, culturally sensitive practical examples, is crucial for ICF adoption in pediatric context. The objectives of this course are to review the ICF model and introduce the ICF core sets for children and youth with cerebral palsy, to understand how the ICF and the ICF core sets can promote interprofessional collaboration, to enhance learners' application of the ICF and ICF courses in everyday practice, and this was key, providing key case scenarios, and to encourage the introduction of environmental interventions and modifications, such as assistive devices, in order to reach optimal functioning. The primary audience of the course is multidisciplinary professionals working with children and youth with physical disabilities, including students and trainees. The educational level, we invite everybody, but I think it's people who are just beginners and learning about the ICF, so they can participate. So we invite professionals and students with basic and intermediate knowledge about the ICF. The format is an online course that consists of 5 modules and that lasts 5 weeks. I think the expectation is that they spend 3 hours per week, and that's what we have learned, that in total 15 hours is what most of the participants are spending. Participants have access to all reading materials, including presentations that are short videos, each included in each module, through an educational platform, and that depends on the resources of the organizations. In Uruguay and Costa Rica, they have used Moodle, but in the Teleton in Mexico or the Mexican Academy of Developmental Disabilities have used a different platform. The course includes pre and post tests that we can assess the learning impact of the material, and the information is available in English and Spanish. As you all know, there are a lot of information about the ICF and ICF-based tools, one example being the core sets, but we have learned that people need to see more practical applications, and so we have developed this color coding, like showing the model and giving clear examples of what it means, each domain, that how you really apply the vocabulary and the content of the ICF in a real scenario. So we usually use this color coding, and you can see that, in blue all the body functions related contents are coding with blue, and yellow body structures, activity and participation red, and environmental factors green, and aqua personal factors. So I provide in my presentations and these, including this course, this color coding, and then along the presentations or the case study, I'm coding the information following this color coding. You'll see another example apply to developmental disorders in general, like this is an example that was published in the Developmental Medicine and Child Neurology last year, comparing the content of the core sets for autism, ADHD, and cerebral palsy. And lastly, you'll see applications, real applications in different countries, and these papers show applications at different levels in Brazil with kids with Zika virus, in Russia, that I'm sure your colleagues are going to share more information about that, in Malawi at the community-based level, and in Poland at the rehabilitation center level. The idea is that the course provide examples at different levels using the same strategy, highlighting the colors based on the ICF and showing people that usually they are applying the ICF, but they are not using exactly the language. And it's important when we clarify with our colleagues which areas we are addressing every day and which areas we are systematically missing every day. It's like a really important moment that they realize that they can work together and don't duplicate efforts and move forward. I think there's a really great interest in applying the ICF, but people feel that they are overwhelmed by how to introduce the ICF in everyday practice. So the course try to show them that there are different levels, and it's like they can do it, and the best way is to try, like in this paper, and report back what works and what is a big challenge, so we can keep learning about that and improve the application. During the presentations of the e-course, we encourage participants to check the knowledge translation website that we created, and it's been active since 2015. It's a pediatric ICF educational e-tool that has case studies, and you see 5 case studies because there are 5 ICF core sets, and you will see that we make a big effort to include positive language, family-centered care, and illustrate how to apply step by step the ICF and ICF core sets in these cases. So this is an open access website and is available in English and Portuguese, and we're working on the Spanish version. Just briefly to describe the participants' characteristics, more than 1,000 colleagues from Latin America and from all over Central and South America, approximately 11 countries took the course. They work in different settings, but the majority represented urban settings. The majority had more than 10 years of experience, and the majority have multiple backgrounds working in rehab and habilitations settings. As I mentioned, the e-course has a pre and a post-test and a satisfaction survey. So these are just some of the questions that I just want to show you the impact and the change in attitudes regarding applying the ICF or feeling confidence in that they are ready to apply that. And there was a vast majority of them, more than 80%, saying that they would start using the ICF in some way, and would recommend the ICF course to another colleague. So I want to share some of the lessons learned during applying and teaching this e-course that I started in 2018. And in my opinion, in pediatric context in Latin America, there are no universal access to ICF education. Currently, learning about the ICF depends on the interest of the professionals. There is not a top-down mandate to invest in ICF education, and there's still no clear understanding of the benefits of adopting the ICF at a higher level regarding administrators in organizations, services, or health and education systems. And I think courses like this and our effort needs to change this. And so it's not just the individual at the clinical level trying to implement the ICF and create tools or adapt tools to their own settings, but I think it just the organization needs to understand why it's important to collect data guided by the ICF and have a rigor in how to select measures and assign qualifiers and translate information into the ICF language. So I think this is a work in progress. Again, I want to share some tips based on my experience, and I feel that I'm learning as I go. So how I approach this, or like when I receive a question saying that we are like interested in applying the ICF or the ICF core sets, if I can guide them, I've been changing my approach and trying to learn more and more how they work, what they need. And I think it's important to adapt the content and format of the educational material to the practical needs of professionals and healthcare users. Be familiar with the content, context, and local cultural belief of families and children with disabilities towards healthcare, so what they expect. We try here in Canada to really encourage people to take a lead in the intervention or like setting goals. In Latin America, sometimes the approach is we need to educate families that we need to work together, and it's not a passive way that you just listen from the professionals or the trainees what's the path in habilitation or rehabilitation. It has to be like a dialogue, and they have a really an active role. So we need to work on that and educate the public as well. Include administrators, IT staff and managers in your courses, as well as clinicians, because it's really important that we work together so they see what we need and they can adapt some electronic records to use the ICF language. And before starting a project guided by the ICF, ensure all participants are familiar with the concepts and what is expected from the ICF, and hopefully complete the educational e-course. So the impact of this e-course so far, over 1,000 colleagues have taken the course. Participants reported that after taking the e-course, they felt more confident in applying the ICF models and the ICF core sets. The main contribution of the e-course was improving interdisciplinary communication, so they learned how to work together, share information, respect everybody's point of view, and see that like if you put everything together, you apply the ICF model and cover all the areas, and don't just focus on body functions or body structures and just some areas of activity and participation. If they work together, they are able to cover most of the areas and learn together about how to include environmental factors. The most useful part of the e-course by far was the practical pediatric case studies, and again, some examples are in the ICF educational e-tool online, and we created new cases for this e-course. Thanks again for the opportunity to share this effort with all of you, and hopefully you have good feedback and we can work together in the future. These are some questions that I would like to ask the forum. And how can we facilitate a standardized, accessible ICF curriculum for professionals and trainees working with pediatric populations? Can WHOFIC facilitate partnership with organizations at the national level to facilitate access to ICF educational material in different languages? And I think that would be great and something that I will willing to work on and collaborate. And how can we collaborate and work together towards common ICF educational goals? Thank you.